Billesley, you're helping me organise the meeting tonight, aren't you?
That's correct, yes. Just need to draw everybody's attention that the meeting is being recorded for future public record and will be on YouTube within the next 5 days, but more likely tomorrow. But we try and get it on within 5 days. Okay, so I'll hand it over to you, Councillor. Dr. Varney is already here, so I'll let you carry on. Okay.
Yep, there we are. I'm on screen now, I hope. So welcome, everybody. This is, as you know, technically a council meeting, and it's a ward forum, which we hold from time to time, usually in person, of course. We were due to have one before the COVID outbreak, but it was put off, obviously, because of that. So here we are, by the wonders of technology. And the purpose of the meeting is really to get feedback, to hear from the councillors, and to discuss issues of community concern. So thank you very much, all those who've taken the trouble to sign in tonight. Now, there are 2 councillors in the Billesley Ward, but we now have a vacancy. My colleague, Councillor Lucy Seymour Smith, ex-councillor, has taken up a new job, and unfortunately her full-time job didn't allow her to continue as a councillor, so she has had to resign. So we're 1 councillor light at the moment, and that means that when people come to vote in the elections on the first week of May, which is the mayoral election and also the crime commissioner election, there'll be a vacancy in the Billesley Ward. So you'll also have a 3rd vote in the Billesley Ward for a new councillor. So anyway, there we are. And I'd like to just pay tribute to the work that Lucy did with me since 2018 when she was elected. But I can understand her wanting to needing to put her family first in terms of her professional role. Anyway, as Leslie said, the meeting is being recorded. This is normal practice. It's like the live stream we do at the council on the major meetings at the council, which would be held at the council house, and then these are made available publicly. They're recorded, so we're recording at the moment. We've got a number of items on the agenda. You should have had a copy of that. It should be accessible in the documentation, but I'll just mention the items in case anybody hasn't got that in front of them. And the first item, which we'll come to in a minute, is a COVID update. And I'm very pleased to say we've got the Director of Public Health, Justin Varney, with us this evening, who will be talking about that in a minute. Then the second item is Billesley Ward Plan, which is a chance to say what matters to you locally. And there's a document available on that, which we drew up actually some time ago, but which we need to share this evening to progress it. Then 5, there's an item of information about Commonwealth Games Community Fund. And then I'm not sure if the police are able to join us this evening. I know Sergeant Neil Ogden has moved on to another role, so he's not available anymore. But I was hoping to have a police update. We can talk about local policing issues, even if they're not there later on. And then that's the agenda, basically. Okay, so what I'd like to do, and there'll be obviously an opportunity for you to ask questions at any point. I'd like to ask Justin Varney to speak to us about the position on COVID and the progress we're making, and the caution that we still need to exercise. So over to you, Justin.
Great, thank you, Councillor, and hello, Billesley. Apologies, I'm working on a split screen, so if you see me looking up towards the left, that's because that's where I can see all of you, whereas my camera is in my laptop in front of me. So that does mean you get a wonderful side shot of my beard, which has been growing a lot during lockdown. So I'm going to talk to you tonight a little bit about what's happening with the case rates, Then I'm going to talk a little bit about testing, and I'll touch a bit on vaccination as well. If you've got any questions, do pop them in the chat box, and I'll try and cover them as I go along as well as I can. So what we're seeing at the moment is that case rates in Birmingham are coming down well. And the most recent data gives us a case rate of about 86.5 cases per 100,000. And that compares to the previous week of about 131 cases per 100,000. So we're coming down by about 30 to 35% every week, which is really good news. And we're currently ranked about 36th highest in the country out of 150 local authorities. So we're gradually moving down as well, which is good news as well. The majority of spread we're seeing is still within households and people visiting other private homes or to do with workplace clusters. And we are seeing, unfortunately, continued small clusters of cases associated with workplaces. We do still see some outbreaks in care homes, but they are predominantly now amongst staff. As we've been getting more and more care home residents vaccinated, the number of care home residents who become unwell has really fallen. But sadly, uptake in staff has not been as good. And that's where we're seeing some of the spread at the moment. Hospital cases have really dropped, and where 2 or 3 weeks ago we were seeing between 80 and 100 new cases a day, that's now down to between 20 and 40 new cases a day at University Hospital Birmingham, which is really good news. And I would expect that our numbers of deaths will start to come down over the next week or two as well. And that's following the overall downwards trend we've had since really the end of January, beginning of February. And it takes about a month between case rates in the community coming down to see case numbers in hospital coming down, and then another couple of weeks before we see deaths coming down. So it's all following the same pattern, which is good news. And we are obviously keeping an eye on new variants, and new variants are variations of the virus that happen all the time. Viruses change, they mutate. It's a normal part of how viruses reproduce, is that they make little mistakes each time, and that changes the virus slightly. And normally that doesn't make any difference, but every now and again we get a variation which is more infectious, kills more people, or makes it less likely the vaccine will be effective. And what we've got around the world is a couple of new variants of concern, where one of those three things is happening, or more than one. We have variants of concern from Kent. So the Kent variant was more infectious. But other than that, didn't really change much. It just became much more infectious. There is some concern it may be increasing deaths slightly, but not majorly. The variant from Brazil, and there's one from South Africa and one from Japan. There may also be one emerging from the US, but we're still waiting on some of the data on that at the moment. So the evidence we have from the vaccine trials that have been going on more recently is the vaccines are all effective against the new variants. They're not as effective, but they still work and they still prevent death and hospitalization, which is the most important aspect of the vaccine program. I'll touch briefly on testing at the moment. So there are two main types of tests we have. They both involve a swab to the back of your nose and the back of your throat. In one, the swab gets sent off to a laboratory. That's called a PCR test. And we use that for people who are symptomatic. And that's very good at finding very small amounts of the virus. So it's good at identifying early infection or late infection. But it doesn't tell you how infectious you are. So it's just a you've got COVID or you haven't test. And we use that for people who've got symptoms where we want to know, is it COVID or not? The other form of the test is where we use the same swab, back of the nose, back of your throat, but it's used with what's called the lateral flow test, which is the rapid test, which is a little kit that you mix that swab with some liquid, you drop it onto the kit, and a bit like a pregnancy test, you get to read the bars, and the bars either say, yes, you're infectious with COVID, or no, you're not. Now, because that's basically some special chemical paper, it's only really good at finding the virus when there's a lot of virus in the back of your nose and your back of your throat. So it's really finding, are you infectious today? It's not very good at finding out if you've only just caught COVID. So think of lateral flow really as a test of, am I infectious or not today? Not have I got COVID or not, because that's what the PCR test can do. But the PCR test takes longer to get a result, is more expensive, has to go to a lab. So the rapid testing is very good at helping us find people that are infectious but don't have any symptoms. And so that's why we're using it in schools, in workplaces, anyone who's leaving the home at the moment, whether that's because you're in a care bubble or your child's going to school or you're going to work, you should be getting a lateral flow test every 3 to 4 days and doing that as a matter of routine. And that's a good way of trying to identify if you've caught COVID and you're infectious and you don't know it. So it's a good way of trying to contain the spread. So those are the two main types of tests that we have. The antibody test, frankly, you can only get privately at the moment. It's a bit of a waste of money because it doesn't really tell you much. We know that people who catch COVID through natural infection, their natural immunity wears off after time. And so you might have antibodies today, but you probably won't have them in 3 months' time, for example. So the antibody test really is only academic interest. So that brings me on to the vaccine. So at the moment, we're using Pfizer vaccine and AstraZeneca vaccine. They work in very similar ways in they're introduced to our body the mRNA, the instruction sheet, the recipe card, for making the spike protein on the surface of the virus. So if you think of viruses, they wear a coat, that's their surface, and on it it's got buttons, and the buttons are the spike proteins. And the buttons are the bit that our body respond to. That's what we create antibodies to. So we see any virus that wears a coat with buttons like this, we will attack. That's what the antibodies are designed to do. And the vaccines work by introducing the instruction, the recipe card, to just make the buttons, not to make the whole virus, just the button bit. That recipe card goes into the muscle cells in our arm, uses the little bits of factory that we have in each of our cells, doesn't go anywhere near our DNA, just the factory bit, to churn out buttons. And as we churn out those virus buttons, our body sees them as alien and develops antibodies, and that's how we get our immunity. We have 2 doses, and you have to have the 2 doses to get the full protection. The first dose is a bit like your GCSE. You get by, you'll have some learning, you'll get some immunity, but it may well wear off after time. By doing the second dose, think of it like the A level, it really locks in that learning and you're much better at defending yourself. So although we know after the first dose, the chances of dying massively reduce, and that's true with either type of the vaccine. With the second dose, you really start to reduce the risk of spreading the virus, and it locks in that protection against death or hospitalization. So that's why the 2 doses are really important. They've done more research to show that the 12-week gap, if anything, actually may improve the immune protection. And it certainly doesn't reduce it. So there's good evidence now that for both the vaccines we're using, that 12-week gap isn't a risk in terms of reducing protection for people. And actually for the AstraZeneca vaccine may make the overall resistance, the overall immunity you get better in the long run. So finally, I'll just touch on the situation in Billesley itself. So up to the 7th of March, the ward was ranked 26 out of 69 wards in the city in terms of the number of COVID cases, where the first rank has got most COVID cases and the 69th have the lowest number. And there were 15 new cases reported in that 7 days. That gives an overall rate of about 0.75 cases per 1,000 population. And the average for the whole city is 0.87 per 1,000 population. So it ranks about 35th out of 69 wards, where the first is the highest case rate and 69th is the lowest. So you're kind of middle of the pack at the moment. We've got 17 COVID champions in Billesley, which is really good. That's one of the good numbers, I think. And when I look at the pattern of cases in the ward, about 37% of your new cases over the last month up to the 7th of March were in people aged 20 to 39, and about 31% were aged 40 to 59. Now that's pretty similar to the general picture across the city. The majority of new cases are in working age adults. Only 3% of new cases over the last month were in over 80s, and that is lower than the general picture for Birmingham. When I look at the ethnicity of new cases, about 23% of new cases were in the Asian community, 51% though were in the white community, and I think that is in line with the kind of demographic of the ward in general, but is slightly different to the overall picture for the city as the whole. And then finally, I just thought I'd give you some information about vaccine uptake in the ward. And you're doing very well, frankly, compared to many other parts of the city. So in the over 80 population, just over 90% of people who are eligible to have the vaccine have had their first dose. Over 90% of 75 to 79-year-olds have had their first dose. And over 89% in 70 to 74-year-olds. So it looks really good, actually. If you look at Billesley as a ward compared to other parts of the city, the elderly population have really been taking up the vaccine. Where I've got concern is when I look at people who are clinically extremely vulnerable. So these are the people who've been shielding for most of the COVID outbreak. In that group, the uptake is only 78%, and we really need to get that up to 90%. The GPs, if someone is housebound, let the GPs know they can arrange for the vaccine team to come out. And there are more vaccinations going on in local GP practices as well. So if you are someone who's been shielding and you've been nervous about going to Millennium Point or one of the big vaccination hubs, do ring your GP and have a chat, because there are different ways we can get the vaccine to you now that we didn't have a couple of weeks ago. And for that group of people that have been shielding, the vaccine really is life-saving. You know, if this all goes a little bit pear-shaped as people rush out of lockdown and we see case rates rush up, the people who are most at risk are the group that have been shielding and the group that are elderly. And we really need to get them to over 90% of vaccine coverage to really protect them. So if you do have friends or relatives that are in that case who've been shielding before, just ask them, have they had the vaccine yet? And they may need a bit of help getting on the booking website or ringing their GP, but do what you can to help build their confidence and help them get to the vaccine, because it is such an important part of where we go next. So I'll finish there, Councillor. I'm happy to take any questions anyone has.
Thank you, Justin, for that. That's some fascinating information. Any questions to Justin? I've mentioned if you want to use the chat function, you can signify by raising your hand. It just means I see a signifier on my machine here. But I mean, just speak up otherwise. Anybody want to come in with any queries to Justin? If you're thinking about it, I'll just make a couple of comments myself. I mean, certainly I've come across a couple of cases, Justin, where elderly people hadn't actually had the vaccine and they were waiting because they were housebound, particularly vulnerable or whatever. And I was able to put their relatives in touch with the system, if you like. But clearly, there may be some mopping up to do in that respect. And thank you for mentioning the fact that, I suppose any of us can contact the relevant authorities. I mean, who would we ring, for example, if we know of a vulnerable person who we think has been missed out? Who would we contact?
So the important thing is that the person who's been missed out, the patient, is the one that needs to ring their GP. And that's because the GPs can't breach confidentiality. So you can't ring on behalf unless you've got that kind of power of attorney for their health. So if you're a relative, for example, and this might be your elderly parent who's got dementia, in that case, you have permission, and that will already be in place with the GP to ring. But in general, it's about saying, have they rung their GP? The other thing is, if you know people who've changed their mind, please reassure them the NHS is not going to judge. We know there are people out there who have changed their minds now. They've read more, they've watched some of the webinars, they've listened to more of this, and they've gone, actually, now I'm ready to take it. But they're a little bit nervous that when they ring up, they're going to be given a bit of grief by the receptionist in the GP practice, because we're always a bit conscious when we haven't turned up for an appointment that we're going to get told off. There is no judgment here. If you changed your mind, the NHS is delighted to see you. What we're trying to do is get the jabs into the arms of people where it will really stop them dying, and really seriously will save their lives. So first point of contact for those people in the vulnerable groups is their GP. For anyone who's eligible, as the new groups are coming on board, so I think it's over 55-year-olds at the moment, you can go on and book direct through the NHS website. Just put COVID vaccine into Google and go to the NHS website. Don't go anywhere else, go to the NHS website, and you can book direct there. But for the vulnerable people, get them to talk to their GP and they'll be able to help.
Okay, let me call Barry Henley next. And could anybody who wants to ask a question just say who you are before you speak? Thanks, Barry.
Okay, I'm Barry Henley, and I'm chair of Birmingham Community Healthcare Trust, and we have vaccinated 3,000 housebound people. Now, those housebound people are the ones we knew about through district nurses and GPs. There may be other housebound ones we don't know about. So there may be a few, but there won't be many. And the fastest way, I'm afraid, when you try and get in touch with your GP, the phone message that's on the answering machine will say, look at our website. And when you look at their website, it'll say, don't call us, we'll call you. Ring 119. 119 is a 7-day-a-week service which will give appointments for people who are in the groups who should be vaccinated, and operates as a catch-up service. So, for example, if you're over 60, you won't get called now automatically by your GP or by the NHS. You can ring 119 and get an appointment that way. Okay, so you can go straight online. And those who've had their first AstraZeneca vaccine can go straight online and book their second appointment if they haven't got one. Just as Justin said on the NHS website. So if you haven't got your second appointment, if you had your first Pfizer one, then you have got to get in touch with the GP organisation that did it if you haven't got your second appointment. It should come automatically, but as you start to get towards 12 weeks, and people are now getting towards 12 weeks, if you haven't got one, then you can call your GP to get the Pfizer one. But 119 for anybody else who's been missed out and should have already been vaccinated, and they answer 7 days a week up till 11 o'clock at night.
Good. Thank you very much for that, Barry. That's very helpful. I wasn't aware of that number, that 119 number. So I think, as you say, that will be very helpful if we're mopping up. And thank you, Justin, for the information you've given us as well. I think I've got somebody else who'd like to come in. Let me just have a look. No, it's not showing up on here. Any other questions? Anybody want to ask any other questions while we've got Justin here? Very good to have the targeted information about Billesley. I've been receiving that, and I'm not very surprised to find that we're in the middle of, we're average, because generally most things in terms of the city, measurements, the statistics, we come out in the middle somewhere, which is not a bad place to be usually. Although obviously I'd like to see lower levels of some things like poverty and stuff like that in some parts of the ward. But generally, the statistics show that we are, pretty typical of that middle area, and we are making progress in the right way. But lockdown, of course, Justin, is being eased, but of course, presumably you'd want to tell us, be careful and you know, don't let up. So do you want to say something about that?
Yeah, it's a really important point. You know, the roadmap that's been set out by government is very clearly going to be progressed through based on the data. And I think Jonathan Van Tam described it best. You know, we've all watched sports matches, whether your passion is football, rugby or cricket. You know, you've gone from 0-3 to 6-3 in the last 2 minutes of the game. You know, we know how quickly things can change. And with COVID, that's the real risk, is that as people see this roadmap, they instantly think that they can do everything now and rush out and mix more, meet up with more people than's allowed. And if we do that, what we'll see is case rates rise very, very quickly. Those people that haven't been vaccinated in the priority groups will be put at serious risk. And we have seen in other countries in Europe that exact thing has happened, and they've had to slam on the brakes and in some cases reintroduce much, much tighter lockdowns. So, you know, bluntly, if you want to see some summer holidays and be able to travel around the country, let alone go abroad this summer, we have to stick to the rules for a couple more months. You know, there is light at the end of the tunnel. If we hold, and you know, I've been in a series of conversations with Chris Whitty, the Chief Medical Officer. I meet with him on a weekly basis with all my other counterparts across the country. And he's really clear on this. You know, if we can hold steady and get to that June relaxation and vaccination uptake remains high, all of us are testing more regularly, then we've got a really strong chance of staying out of lockdown well into the winter. Now, it's likely that come the winter, depending what's happening with COVID across the world, we might have to see some measures brought back, like wearing face masks, for example. But actually, if we can really hold out to the summer, there's a good chance we'll get a pretty good rest of the year with a lot of those freedoms staying. If we let it go sooner than that and case rates surge, then the chances are we will be in lockdown for much of this year again. So it's really on the decisions we each make every day, whether we'll get to have that relaxed summer in the sun, I hope, or whether we're going to be locked down for summer again. So it is that we've got to think about when we are trying to decide, do we follow the rules or do we step out when we shouldn't?
Okay, thank you very much for that, Justin. Okay, any other questions then or comments for the Director of Public Health? As I say, it's great to be able to hear the messages directly from him. I know how busy he is, how busy he's been over this last year. You know, again, I'd like to put on record my thanks, I'm sure, on behalf of everybody for to all the staff who worked so hard on this. And now, thankfully, there's a lot more of a local focus. I think that's why the vaccine rollout has been much more successful than, shall we say, test and trace and some of the other issues that we know have got in the way of tackling this pandemic. But anyway, I don't see any more questions or comments, Justin. So can I thank you very much for your contribution this evening, which is very much appreciated. And we hope that obviously the positive trends continue, not least in Billesley. And thanks very much for the snapshot of what's happening here.
Okay, thank you very much. Thank you for having me.
Cheerio. Okay, the next item I've got is the Billesley Ward plan. As I said at the beginning, this is really an opportunity to pick up some of the issues in the ward, which we feed into the sort of the council as priorities for action in the ward. And with Lucy Seymour Smith, when she was councillor, we'd identified 5 points. I haven't got the facility to actually circulate these to you, but I can just refer to them quickly. One was to tackle irresponsible parking and damage to grass verges. Second was action on low-level antisocial behaviour, particularly graffiti and dumping. 3 was to restore CCTV provision in the ward, related to that sort of antisocial behaviour. 4 was, promote a visible police presence, particularly from the new joint fire station police base at Billesley Fire Station itself. And then 5th, to support our young people, working particularly with community organisations, faith groups, and the children and family centre organisations like Moseley Rugby Club and their youth work and so on. So we can add to those, but the idea is we get 4 or 5 principles that are broadly supported, and then that means we can focus resourcing a little bit on that. Not that the resourcing is always available to do everything we want to do, as I well know, having dealt this week with a list of requests for works by the district engineer in the ward, and we had a budget of £40,000 to spend, and we had about £140,000 worth of requests. So 'twas ever thus, so we can put it on the list, but there is a limit. But anyway, those are the sort of areas. So really, anything you want to say about those areas or other areas you think should be included would be very helpful, because we'll then feed that into the council process about the ward plan. Anybody want to come in?
Bill, I'd just like you to feed back to the council. I'm so grateful. We had graffiti on our church centre, and I just went past to do a funeral, and when I came back it had gone, and I believe the council removed it for me. So please feed back. I'm so grateful to that. Well, next job.
I'm very pleased to hear that, Lydia, and good to see you, because I know you had I think you had a problem. You were ill, weren't you, with the COVID? So good to see you. Again, I say that because I haven't seen a lot of people for a long time who I would normally have been bumping into quite often around the ward. But yes, I'm glad to hear that, because I do report graffiti very frequently, and the council will remove it. And on the whole, they're not bad at doing that. But we have a big problem with some of the utilities. Western Power is good. BT are quite good. They have the little green boxes, which often get tagged, as you know, but I'm afraid Virgin Media are very poor. They have cream boxes on the streets, and Royal Mail, again, very bad. So what I've been doing on this, apart from trying to get more action locally, and trying to link this with obviously resources, I've initiated a discussion with the cabinet member, Councillor John Cotton, and we also have a link with the police through the local community safety partnership for Selly Oak. And I'm trying to push this up the agenda. The good news is that partly because of the Commonwealth Games, there is possibly more money available to do some of this. And I'm hoping that we can feed that into the ward. That's why we put it down as a priority in the ward priorities, because I think there is a lot more we should be trying to do about it, because it's just unacceptable. Why should people whose private property have been defaced be faced with having to clean this up all the time? Another idea is possibly a local fund, which might give us more control, and I'm very grateful to Barry Henley for some information he sent me about how we might structure that, and I'm hoping to move that on in the next few months to see if we could get a pot of money for a Billesley environmental charity, basically, which would give us, we'd have a couple of independent trustees and the councillors, and that would give us a basis on which we could actually get stuff removed and offer maybe grants to shopkeepers to do that stuff, to get that removed rather quicker than the council can. Though, as I say, the council will do that. And if you've got a particular problem in any locality, let me know and I will chase that up, obviously, as the councillor. Sorry, that was a longer splurge from me. Occupational hazard. Lydia, did you want to say anything else? Okay, just anyway, good to see you. So, as I say, we've tried to also identify things like grass verge works. I have to say that these works that I've just agreed, this £40,000 worth of works, is basically on grass verges and so on. But I see a couple of people indicating, let me go to them. Can I bring in Linda Batchelor first and then Deborah Collins? So Linda. Linda, are you there? Maybe there's some might.
Can you hear me now?
Oh yes, we can hear you now, Linda. Yes, that's great. Hi.
Yeah, I was on mute. Hello, everybody. Yes, I just wanted to follow on. As you know, I'm based at Billesley Rugby Club, and we are surrounded by car parks that invariably get full of litter and full of those little drugs canisters that we see all over the place these days. And whilst it regularly looks a mess, the council do come round and do quite a good job of clearing up the rubbish. And I just wanted, if we're going to say good things about the council, which is very rare, I just wanted to feed that back, that they do respond. But it is a bit of an uphill struggle, because no sooner have they cleared it all up than people come back and think, oh, that's lovely and clear, somebody's tidying up after us. And they dump all their rubbish again, get quite a lot of it's not massive fly tipping, it's household rubbish that gets dropped there, but it does get cleared up. It's just, yeah, how do we solve the problem of littering and fly tipping?
If you can report.
We do report, that's what I'm saying, we do report, the council do respond very quickly and very well. It's just that I would be on the phone to them every single day to clear up around by Billesley Tennis Centre, around by Greenwich Primary Care Trust, and at the rugby club. I would be on the phone to them every single day. That's not a very good use of a resource. I don't have a solution. I just wanted to feed that in. Again,
I think CCTV. It's not a cure-all, obviously, but
no.
More use of it is a good idea. We did lose a lot of that because of the cut. Let me bring in the Reverend Deborah Collins. Deborah. You're still muted, Deborah. Deborah. Anyway, she'd indicated her hand was up. So no, I take the point about that, and I clearly we've got those points in the ward plan, because frankly they're the sort of things that people raise with me very frequently, and I see myself, living in the ward. So I hope we've got that right. What we need is a more joined up approach to it and more resourcing. And as I say, I'm trying to make that connection at the high level. What I would say as well, though, is graffiti is criminal damage. What has concerned me, the police aren't here today, but we really need to report it more often to the police using the 101 number. I know you don't get an immediate response to that, but if it appears on their logs, then they then think more about it in terms of prioritising some action. And I really like to see them do a bit more intelligence work about finding out who's doing this, and trying to have a prosecution. Now, I think I've got a couple of people indicating, so let me shut up and go to them.
Can I just add in on that point that actually yes. I was in a meeting with the police and they are following up the graffiti, and they have got a certain names of people that they think it could be connected to. Excellent. So they are trying to get to the bottom of it.
Right, that's good, because that's what we need. We need a couple of just they won't be able to find everybody, but a prosecution would be good.
They also at the rugby club came along and took photographs of the graffiti, the tags, and were able to track people there. And I think the more people realise that that's happening, that there are consequences, then maybe the less it will happen. I don't know, but the police were very good at following it through.
Let me bring Chris Chalmers in.
Yeah, so I was just going to ask about not the graffiti, but the stickers. So on Bridgefield Road, and I've noticed in other places there are now stickers, and you can't get them off very easily. I thought I'd get it off the road sign, but they're really. Has the council got any recommendations for getting them off?
Well,
clean them off.
I've tried myself, actually. I think I know which ones you mean. So yeah. Again, we can report that to the council, and they ought to be able to remove them, but it may be that they need to use a particular type of material to do it, you know, which so it's because I've tried myself and it is difficult. Sometimes you can wipe graffiti off, can't you, but stickers are different. So yes, so we'll keep an eye on that one. And but I'm very pleased to hear what you've said about the police following up more, because I did have a conversation with Inspector Nick Geiss, who was just taken over as the senior officer for obviously bigger than just Billesley, and he was keen to do something on this. And although we've lost the sergeant, Nick Ogden, we'll be getting another sergeant, and so it's important we keep that conversation going with the police, isn't it, really?
Well, the first time I was tagged, within about 2 hours of emailing them, they were there. I had the community sports officers and the police sergeant cleaning the graffiti off for me.
Well, that's excellent news.
Stuff.
Yeah,
but they also provided with me with a graffiti removal kit, because the police have some kits that they can loan out to people to remove it as well.
Yeah, we should publicise this more, I suppose, shouldn't we? Really, and because I was aware of those kits, and you know, I've done some of that myself. Good, I'm glad to hear that. So we've got that on the list for the ward plan as well, and then more generically, this plays into really what you're all doing. You know, supporting our work with young people, the Children and Family Centre. You know, obviously the Rugby Club. Your work up there, and the faith groups. So those are our 5 points. It's whether is there anything anybody thinks is glaringly missing from what we should be saying about what we'd like the council or the ward to plan to do, you know, because it is about saying to the council, we'd like help with this, we'd like resources for this. Okay.
Can I say the potholes, or
yes,
are we not allowed to?
No. I mean, by all means, I can say, I can give you a sort of update on that. What's happened with the state of the roads? Because I often raise the issue, because people raise it with me, about the state of some of the roads. I mean, Trittyford Road, I think, is in a poor state, and there are others, aren't there? You know, but because the contract with Amy was terminated a couple of years ago, you may remember, it ran into the sand because Amy weren't doing what they said they would, and there was court action, and the council's position was upheld by the courts. And there's been a settlement of that apparently, but we're now in this transitional arrangement with the company called Kia, and Kia are acting, you know, they're a big similar company, and they're acting as our contractors. So the person I talk to now, like Stuart Cross, who's the highways contact in our ward, he works for Kia, but he works for the council ultimately, and so I report matters to him. The difficulty is that they're doing a survey of all the roads across the city, and they haven't yet concluded that. And after that, there'll be a conversation with the city about what they think they can do and what it will cost and the rest of that. So there is some delay, which is why some of the roads which really need work, like Trittyford, are not just pothole filling, which they will do. So yeah, keep reporting that, and I will also report it. But major resurfacing will have to wait, I'm afraid, until that contractual matter is resolved, and I think that will be hopefully 6 months or so, and then we'll be able to move on. But certainly I'm very aware of that. Pardon me. So, okay, can I just say, you've given some very good feedback on the ward plan. What I need to do, pardon me, is I will be passing that on into the council machinery as the submitted plan from the Billesley councillors. I may have to wait till we've had the election of the second person. I don't know, I'll have to take some advice. But basically, this will be the framework, and we'll be able to argue around those issues on resourcing and other matters. It doesn't mean that other stuff can't be considered, but it just gives us a framework, and it's the way the council works. Each ward is asked to put a plan which the councillors endorse after public discussion. So thank you very much for that discussion. That has been really helpful.
Councillor, you have one more question from Deborah Collins.
Oh, right. Sorry, Deborah. Yes, I should have spotted your hand there. Sorry, Deborah. Yes.
No, that's okay. Can you hear me? I dropped out earlier.
Okay.
You can hear me. So I'm sorry, I don't know what I missed, but just regarding the amount of litter and tipping that goes on down the bottom of Brig and cross on the Yard Road in the road, affecting the mental health of people that live on Brigfield Road, to the point where I certainly know one lady that won't go down the bottom, won't leave her house that way now. She does an alternative route because it's just so depressing to see it all the time. And I know that the council do come and take away the large amount of fly tipping that goes on the service road, but there's a bank below, I think, is it Brigfield, is it Crescent, that is continually strewn with one of our church members, well, a couple of and her family member. Well, it was like just the tip of the iceberg, really, just getting cans and bottles, removing them from that space. And I was wondering whether we, you know, a small team could get together, we could borrow some implements, but also have some planting, because it's there to low level sort of shrubs, so that it's covered, it looks more pleasant. But yeah, I know that you do as much as you can collecting things, but it is quite depressing, and it is affecting mental well-being.
Yes, and I'd like to thank the volunteers who do go out and do volunteer litter picking. It's been affected by COVID, of course, as has the cleansing regime. But what I'd like to do, Deborah, is come down and meet you, just show you. I mean, I know the area, obviously, but your local residents will have, and church members will have local knowledge. So let's arrange for me to come down and you show me, and we can have a look at all that, and then I'm sure we will be able to arrange some support for voluntary litter picking. Although the council at the moment is saying they won't give out the grey bags, which they normally provide free, because until the COVID restriction is slightly further lifted, they can't encourage people to go out and do that. But I know some people have been doing it anyway, which is good, frankly, you know, as individuals. Barry's signalling, because I know he and his wife Beryl are very active on this. And again, you know, and I've done it, and I think it helps a lot, and it sends a signal, doesn't it? But I'll give you a call, I'll email you, Deborah, and I'll come down and we can have a look, you know, suitably socially distanced, but we'll be able to do it, I'm sure.
Thank you.
Thanks for raising that. It's something we are very aware of. The good news is there's slightly more money being made available for the fly tipping collection teams. I think we're going to have another 2 teams for the city, because we've just done a big study internally, and you know, members are very concerned about it, because it's you know, it is a real problem, and it does, as you say, affect the mental health of residents. They don't like to see it, and quite rightly so. So we're very aware of that. We're hoping there'll be some more resource available fairly soon. So that's certainly on the list as well for the ward plan. Thank you for raising.
Is the fly tipping connected to the fact that tips you have to book in now? Have you seen a rise in fly tipping because it's so hard to get a slot at the tip?
Yeah, well, I think, I mean, this is, you know, it makes sense, doesn't it, really? And I think, I haven't asked for the figures, I could do that, but it's pretty much the case. It has affected it, I'm sure. And the other side of this was that we have charged, because of the loss of resources from government grant, we've had to charge for removal of large items. And I've always felt that was a bit counterproductive, really. What we have now done in this budget is we're saying that if anybody's on universal credit or other benefits, they won't have to pay, because there's I think it's a £35 charge, you see, if I want an old settee removed or something, which is fine, you know, I could pay that. But I really think it's probably a good idea to make that free again, because it's just a disincentive, isn't it? Although the study we've done suggests that there's also, as we know, a criminal minority who just dump, and, you know, it's hard to educate them. And we've had some success. We had a big prosecution recently. The guy was fined £6,000 and sent to jail for a year. and that was dumping from the back of a van. And we've had this problem in Billesley as well. There's a particular site at the top of Ravenshill, which you'll know, and I'm pressing the planning authority, the planning department, to really take proceedings against that. And I'm unhappy about the amount of time this takes. But I really think we need an effort to take that property off the person concerned if they're going to use it as a sort of unofficial dump, and that's what I'd like to see. Anyway, okay, well, thank you for that, everybody, on the ward plan, because that's again really useful feedback, and I can follow up those issues as well with you individually, as I will with Deborah. The next item I'd got, it was really information, which I have already sent, I think, to a number of people here, and that was the Commonwealth Games Community Fund. And it's an opportunity to tap into a large fund which is celebrating the Games for community activity. And I've sent you the details, the organisations I think that are represented here. And then it's about bidding. But I did want to mention that generally to anybody else who I hadn't communicated that with. I can. There's a website actually. It's probably the easiest thing to say is if you're interested as an individual or as an organisation, really be an organisational bid. But you can organise something around this as an individual organiser. Then just go to the web and look for Commonwealth Games Community Fund, Birmingham. And that should give you all the information about how to apply. Now, somebody is indicating they want to ask a question. Linda, did you want to come in on that? Or is that from your last? You're muted, Linda.
Yes, I was just saying I'm here today, not just representing myself as a resident of Billesley, but also Moseley Rugby Club and Kings Heath Cricket and Sports Centre. And yep. we've had a look at the community funding, and we're all interested, both sides, the cricket club and the rugby club, in trying to run some Commonwealth Games activities. But I just wanted to know whether I've got meetings on Friday and next Wednesday to discuss this with the various, with the two clubs. And I just want, do we then have to go back through you, Phil? Or, because I've had a look at the application process and it does say that we have to make sure that it's linked into the ward plan. And so I wondered if that meant I have to involve you at some point.
You don't need my say so, which is the good news. But really, the ward plan, point 5, support our young people. Yeah. It's written generally enough that it will fit in with this. Okay. And I've seen that we got the ward plan process moving, so that we didn't get in the way of exactly this. But yeah, don't assume you have to come back. It would be great if you can copy me in, so I'm aware. And I would be supportive of this sort of scheme. But it's not a huge bureaucracy.
Okay.
Okay. Okay, but if anybody's got any queries about it, as I say, the website is there. We've just been briefed about it. I can obviously follow up anything that's unclear. I think I'm getting some feedback here. So probably if you can mute your microphone.
Well, I was just going to come back on that. I was going to say. Okay.
Yes, it may not be you, Linda, it may be somebody else, but yes, come back by all means, yeah.
Okay, I was just going to say, as the rugby club and the cricket and sports club are going to try to run some fairly dedicated Commonwealth Games activities, if there's other little groups who want to come in with us on that, then that would be brilliant. We could do something collectively rather than me doing something for the rugby club and doing something for the cricket and sports club, and then the church is trying to do something separate. I just wondered if that was an idea, and we could perhaps develop that. So we've got some subcommittees of Commonwealth Games activities.
how should people contact you then, Linda? What's your
Email.
Email you. Okay.
Yes, please.
And anybody who hasn't got Linda's email, I've got her email, so email me and I'll get you, and I'll, with your permission, Linda.
Yeah, absolutely. And also, Phil, I know you said we don't have to go through you, but it might be useful to use you as like a conduit to other groups, as I'm meeting probably the two, as I'm involved with two of the largest sort of sporting arenas in this area. If I feed things through you, and then if you can pass them through, so if anybody else is interested in getting involved or developing it, then
yeah,
you know,
no, that's great. I'm very happy with that. So please do that. I think we've got a couple more. Karen Cheney from Karen's the Selly Oak lead officer. Karen.
Hello, everybody. Sorry, no longer Selly Oak lead officer. Don't exist anymore. Districts, unfortunately.
Yes, I know.
But I think I know most people. Selly Oak NNS, I will know people.
Right.
But I just wanted, I'm sorry to interrupt. I just wanted to clarify on the Celebrating Communities grants, Commonwealth grants. They do come back to ward forums because it is a community vote. You can independently apply, but what you've been saying is great that you do them collaboratively. But they all come through because NDSU are collecting all of the proposals. But the idea is once they're in by that closing date, they will come out to a ward forum meeting, and how you then decide to vote, whether you put your hand up or you're very techie and you use some sort of that way, but it is then back for a conversation. But there are 3 small grants themes that are being made available. So the overall pot was 6 million. So the Celebrating Communities is just one of those pots. So Linda, I think the more sport and leisure type activities, I think that's also just been announced. So you might find that some of your things that you want to do are probably might be better fit into that one. The third one is culture. So the Celebrating Communities is really the one that's very much at neighbourhood level, with an amount that has been assigned by every member for that sort of collaborative stuff that you said about celebrating communities. It might be an event. I know some of you who've come into the Billesley NNS catch-ups got very excited last time about doing a group kind of big project together. Would fit ideally into this. So there are 3 separate little small grant pots, but it's the Celebrating Communities one which comes back through the ward, and there are two you can apply over the 2 years. So there's one that I think it's in by June, and then there is another one that's next year leading up to the games. So I didn't want to disappoint or confuse anybody, but it's worth having a look on the website. I have tried to put the link in the chat, but if you go onto birmingham.gov.uk, put Commonwealth Games in, it'll come up anyway. Okay. Thanks, Councillor Davis.
Thank you, Karen. I should have known that you were the go-to person on this. So thank you for that. That's very helpful. And of course, the ward forum will be available to help with the process, I'm sure. Yeah. Great. Okay. So I think the message on that is keep in touch. Let's all keep in touch on this because it sounds a very exciting possibility, doesn't it? You know, we all want to celebrate the Commonwealth Games, but make it meaningful at the local level as well as in the city centre and wherever the sport is being conducted. Good. Okay. Now, I've got down next local policing update, but the police can't be with us this evening. So unless there's any pressing issue anybody wants to raise on that, I can feed that back. But as I say, the local change is that Neil Ogden has moved on to another role. So we're waiting for the local sergeant, for another sergeant to be appointed. but Nick Geiss has been very helpful in terms of the connection with the inspector, and I'll be maintaining that link in the immediate future, and I'll pass on any policing concerns. Okay.
Nosy, Phil, what's Neil's new job? Do you know?
It's a liaison role on community issues in the Northfield constituency. I've just had a brief email from Nick, and I have since written to from Nick Geiss, and I have since written to Nick Ogden saying, sorry to hear you going. Thank you for all you've done. Because I think he's been a great influence in the ward, and very calm, very helpful guy, but obviously doing his duty quite properly as a police officer. And I'm sorry to see him go, but obviously, if it's good for him, that's great. So we'll wait and see. But what we would hope to do, obviously, is get, when post-COVID, I mean, we can have a meeting like this. I mean, I'm open to. I think one of the things we've learned from the COVID process is actually sometimes these online meetings allow more people to participate, don't they? And we could certainly do something like this again. But we'd obviously be looking to do some of the traditional style ward forums as well, or maybe a mixture of the two. It's perfectly possible. And then we would have a police slot on that with the officers coming along. Any other business? I just wanted to mention the census, just as a reminder, really. We've all been contacted as councillors by Alison Brinkworth of the census scheme, and she is there to, if there are any problems with this scheme. She's I think if you go to census.gov Birmingham or census.gov Billesley, you should be able to get a link. But if you have any problems, any queries about the census, contact me and I can give you Alison's contacts, because she's there to assist with any information that you might want. Has anybody else got any other business they'd like to raise? No? Okay. Well, as I say, we will be doing this again. Again, I don't know when we'll be able to meet in person, but as you know, we're looking at potentially June, depending on how well the move out of COVID goes. It may not be June, and then I'm hoping, in the summer and beyond, there'll be an opportunity to meet you again in person, even if it's just to have a coffee 1-to-1, which I've certainly missed, over this last year. And it'd be good to do that, to see you in our normal community settings, which we haven't been able to do. But we will be having another ward forum, and I'm very grateful for your contributions tonight, because it will feed into the ward plan, and we'll be able to register that ward plan and obviously assist with things like the applications for the community fund. So on that note, can I thank everybody for taking the time this evening? And people are waving goodbye, which is quite appropriate. So as they say, stay safe and good to see you all. Bye. Bye.